Welcome to Planetary Health First, Mars Next. I am super excited today. We're here live at VIVE, and we got Pranam Ben. He is the CEO founder of the Garage Inn, and he is doing some super amazing stuff. He is not a stranger to healthcare. I believe it's like 2012 he's been working on this task of data, not just data, but meaningful data to really drive population health, to make outcomes happen. So tell us more about what you're doing. I'm so glad you're here.
Good morning, Michael. I'm glad to be here. So the work we started in early 2012 was to empower more value-based care across all communities. You know, healthcare traditionally has been inside out and reactive, and we felt that it was time to make it outside in and preventive. So that's basically the work we're doing with making data more actionable across all touch points.
And what's your biggest finding or learning from trying to get into healthcare?
The biggest learning is that, you know, in healthcare, people talk, systems don't talk. So we had to build that strategy to allow for data to be the glue between different systems, so you can empower more, patient-centric care and empower the humans involved in providing that care.
And is that what I'm seeing on your website, that like terminal, the air flight kind of path? Is that kind of that model, what you are doing to make that work, kind of, if you would?
That's a great question, Michael. The inspiration to that airport model is what we call it, is if you think about the airport, right? The airport functions as a hub to allow for travelers to go from point A to point B. So we said you want to build a system that works very similarly like a hub. So the patient, the traveler, can go from point A to point B in the right time, in the right way, for the right reasons. And every provider organization, the entire ecosystem had to function just like that airport. That was the inspiration behind it.
What is the problem right now in healthcare?
I think if we have a very bloated, top-down healthcare system, and the care is not easily accessible to everyone that needs it, and definitely not affordable to everyone that deserves it. I think that's the crux of the problem, and there are a lot of other, logistical, tactical issues around the middlemen involved, the pricing of the services in healthcare, and things like that. So it's a multidimensional problem, but I think every year, every day, every month, there is good work happening across the sector. Some of it we are directly involved in, and change is happening, and the change is real.
What is the most exciting thing right now, 2024 today, that you're excited about, that you're doing?
We've taken on this, mindset, this vision of a digital-first, data-first approach to changing healthcare for good. I think that's been our most exciting experience in the last few years, and I think the time is now for the entire ecosystem to align and leverage tech and data to provide better care at lower cost.
Awesome. Well, I'm so glad we had you on, that you were able to get on with us and tell us more about. Is there anything else as we're kind of wrapping up that you'd like to share about you and your organization, initiatives, projects, how to find you?
Yeah, we are pretty out there. You know, you can find us on LinkedIn at the Garage Inn, and we do a lot of community-facing work, and we are a platform that allows for value-based care to be democratized across all communities. So, my message to everyone listening is, in your own way, please support the providers and care teams that are driving more value-based care, that are allowing for patients to receive timely care, and we'll do our bit as well.
Well, Pranam, it's been so awesome to have you on live at VIVE on Planetary Health First, Mars Next. I hope everyone that's been with us on this journey that you've enjoyed this.
Thank you, Michael. Thank you for having me.
It's been awesome.
Thanks.